Dear friends, welcome to episode number 20 from the Psyche and Human Body podcast. I'm your host, Reda, and today's guest is Dr. Patricia Oleveira. She's a specialist dermatologist. Today, she will be discussing the background and experience in aesthetic dermatology. In addition, that she's going to be explaining the difference between aesthetic dermatology and classical dermatology. Dr. Patricia today will be highlighting the various treatments and procedures she specializes in addition to the cultural differences in the aesthetic treatments between Brazil and the UAE. I hope you enjoyed today's episode. If you have any questions, please leave them in the comment section below. And you can find Dr. Patricia Oleveira at Derma in Dubai on Instagram. If you want to follow her, she has a wonderful page. I hope you enjoy the episode, and I'll see you in the future. Thank you very much.
Good morning, Dr. Patricia. I want to welcome you in the show and say thank you very much for accepting the invite. I very much appreciate your time today, and I feel very grateful for you.
Good morning. Thank you for the invitation. It's my pleasure to be here this year.
Wonderful. Doctor, can you please start by introducing yourself? Tell us who is Dr. Patricia. What's your backstory, please, and experience?
Okay, so I'm Dr. Patricia Oleveira. I'm a specialist dermatologist. I'm Brazilian. And after 16 years working in Brazil, I moved to Dubai 1 year and 9 months ago. I came with my family. I have 3 kids. They are 10, 12, and 14 years old. And my husband is an ophthalmologist. We are so happy to live here in Dubai. And my main focus is aesthetic dermatology. So I work with different kinds of injectables like Botox, fillers, collagen stimulators, and different devices like lasers, HIFU, infrared. And one of my top treatments is non-surgical body contouring. In Brazil, this is very famous and popular. So I'm so happy to live here in Dubai and to meet patients from different parts of the world.
Beautiful. Doctor, just let me, before we start into the details, I need to know, why did Dr. Patricia choose this field in particular? Did you choose it like willingly, or did you just like follow the river of life, let's say?
No, so first, I'm a pediatrician, so I decided to be a pediatrician first. But while I was studying, in Brazil, it was 2 years at that time. So after 6 months only, I started also presenting lectures of skin disease for kids. So, and then I thought, why not? I changed to another field, but I was worried, and if I don't like. So first I finished, completed pediatrician, but I never worked with this. And then on my first years as a dermatologist, I was doing both types of dermatology, like skin cases, so the classic dermatology, and also aesthetic procedures. After 8 years, since the beginning, I had my own clinic, and my husband was my partner. So after 8 years, I decided to work only with aesthetics, because was what I like most, and mainly I was attending only conference and workshops for this field. And here in Dubai, I work with aesthetics. Some skin cases like acne, melasma, hair loss, and rosacea, and all the procedures that I mentioned before. And I don't do any kind of surgery. So non-surgical aesthetic procedures, what I perform.
And doctor, what's the difference between the aesthetic dermatology and the classical approach? Like, what do you do in the classical approach of dermatology usually?
So you do the bone mapping, you treat different types of skin cancer, you treat fungal disease, allergies, and bacterial infections. So this is the classic dermatology. And you can do also some surgeries to remove skin cancer and cysts and other lesions. And on the other hand, there's aesthetic dermatology. You work with injectables like fillers for the face, body fillers, intimate fillers, and lasers, different kind of laser devices, microneedling, collagen stimulator. So this is my field.
Wonderful. Doctor, what's the difference between, let's say, the culture in Brazil and the culture here in the UAE in terms of the kind of treatments which you do back then and now? Are they similar or is the culture different?
No, it's different. That's it's become more and more common for patients to book with me to treat what I talk a lot and what I used to do a lot in Brazil. So mainly in Brazil, many people, they don't have money to travel. It's not their priority. It's not about having or not, because they spend on their beauty. So they get a loan, they pay in 1 year, so in 12 installments, because they want to be really, really beautiful. And it's not only for the face, because they like going to the beach, so they want to have amazing body, and they like sun tanning, so also it's damaged the skin, and they need to do treatments to improve the photodensity. So, but here, I think it's changing. They are more interested in facial treatments, like fillers for lip fillers and treatments to lift their face. But since the beginning, I'm talking a lot, like I used to do in Brazil. I talk a lot, not only for the face, but also for the body. So my followers, especially on my Instagram, that I'm so active there, they come to do both treatments, and it's become more and more common to do wet lifting, not just butt lifting, and treatments for the abs, to treat the stagnance, and inner arms, inner thighs. So I'm a trainer of sculptor. That's a kind of collagen stimulator, and wrestling. That's a kind of filler that I've been using for more than 16 years. So I'm a trainer here in the Middle East since last August. And there was a trainer a few days ago. And I was talking, we have this, they had some doubts how to introduce body treatments, because it's not easy for them. They are doctors from the Middle East. It's not easy for them to talk about this. And I gave them some ideas, like when the patient arrives, they have a document, they have image to check, to list what's body, what's motivating them to go for a consultation. But instead of having the image only of the face, there is an image of the body as well. So the patients, they will know that you treat not only the face, but also the body. And also, I told them, if you talk about this on your Instagram, some people, they don't know that after childbirth, there is a treatment for the saggy skin, especially on the belly.
Oh,
They think everything is surgery. Everything should be treated with a surgery. But this adaptation for you is easy because you feel so comfortable to talk about butt lifting, body contouring. And so for me, it's really natural, and it's one of my favorite statements because my whole life, I've been talking about this. And in our culture, it's easy and it's common. So there is a huge difference, but I think it's become easier every single
Yeah,
day.
I can think actually.
And yes, and we say now that the body is the new face. So every conference they talk about this because now everybody people are not seeking for less faces. They look nice, and it's time now to talk about the neck and downwards uh, treatments.
Beautiful. I think it's gonna be like a challenge to bring such treatment and try to, let's say, tailor the community over here to such kind of adaptability, for example. Doctor, let me just like start with that kind of treatment, which is the butt lifting. How does it usually go? Like, for example, is it like a Botox injection? Like, how does the procedure usually go? Can you please like give us an understanding of what it is?
Yeah, sure. So first, the most important thing is the assessment, and depending on the nationality, the body shape is going to be different, and also the desires and the need. So depend on the nationality. They want volume. Others, they just want to treat the cellulite. They just want to treat the saggy skin. So I listen to my patient concerns, but almost all they have no idea how and where to inject any products that they want to enhance the area. So I show some, because I miss lectures about this, so I show some pictures, what makes the butt beautiful. So I talk about the shapes, that the square shape is easy to turn to, not easy, but we can change to a round shape. The V, it's really difficult. So maybe with some implants, and then I have to refer to a plastic surgeon. So I have to refer to my colleague. And the most desired shape is the heart shape, and the second the round shape. So I show some image, and the difference between the round and the heart shape is just the waist circumference. Because if the waist is small, and then it comes round, you compare, and then it will be called the heart shape. If it's almost the same but round, it will be the round shape. And then we have the square and the V, or the inverted triangle. So I explained this, and what we are going to check when we take the pictures. So I explained to my patient, seeing her picture, and I explained that there is an ideal distribution of the volume. So if we divide, we check where is the projected area, the point that's most projected, and we trace a line. 50% of the volume should be above this line and 50% below this line. So for some patients that are 50-50, there is a lack of volume on the lower part. For others, is the opposite. And also the projection. I see if it's too projected or if it needs some projection. So there are specific forms that I check and I explained before on those images. So they start understanding. And the infragluteal fold, if it's too long and deep, it shows that there is a stagnancy. And then when I take the pictures, the patient understands their needs. Also, I check the skin quality, if there is cellulite and rash marks. So I trace a plan. You are a candidate for lifting, and you also need to treat the hip teeth. That's the lateral depression that some patients have. And also I check the lifestyle, if they are dieting, exercising regularly, because it's important. And then I explain, you are a candidate to do body fillers. with body fillers, you're going to see an immediate effect. It will last around 1 year. And I explained the aftercare. For example, I recommend the patient not exercising for 5 days and not doing any kind of massage. And if the patient is a candidate for collagen simulators like sculpture, patient will not have any downtime. However, they need to massage for 5 days. So it's the opposite. And sometimes they come asking about body fillers, and I explain and I convert them to body to collagen stimulators. And sometimes it's the opposite. So with collagen stimulators, we can lift, we can treat the hip tips, we can reshape the contour, we can treat cellulite, and we can add projection and volume. But it takes some days because we need to wait until the collagen and the new elastin will be produced. So if the patient is in a hurry, but they are a good candidate for any of the treatments, we can do body fillers. But for example, if the patient is complaining or if we see that there is a lack of volume on the inferior part, I cannot recommend body fillers because if I add volume on the lower part, it will make the part heavy on the lower part. So it's not going to be beautiful. So fillers, mainly we recommend for the superior part, or the lateral part to correct the hip tips, and to the posterior part to like projection and volume. So, and I don't want to put any pressure for the patients to do the treatment, but I'd really like to educate them to explain why and how we can do this or that treatment and what to expect, how many sessions, and almost all of them decide doing on the same day. But if they are not sure, or if they need to check not only to research, to check other opinions, but sometimes it's about the budget, because everything for body is more expensive than for face, because we need to use more products. So I let them go home and think about this, and then they build a good relationship.
I see. Doctor, I have a question. What's the role of massaging after the procedure? What does it do? Like, why is it not recommended to train? And why do we have to massage?
Okay, so when you do body fillers with hyaluronic acid, I recommend not to massage and not to exercise. So, because we don't want to have any migration. We don't want the product to move and to be displaced. Only for 5 days, because we are going to apply on specific areas to add projection and volume. But it will take a few days to integrate to their own structures, to the palate and other structures, other layers. But when we are talking about collagen stimulators, it comes as a powder in a vial, and we add stereo water, and then we will have the product that I'm going to inject. And we, for example, when it's for the butt, I apply on the frame, on the superior and lateral parts of the Botox to lift it, and I will inject some amount on my target area. So it can be, for example, where the patient has a light, or where I want to add volume. But this product is always transparent. It's not a gel, it's not like a filler. And it's going to cause a good inflammation that's going to bring some cells to that area where the product was ingested. And those cells that are called fibroblasts, they are going to produce new collagen and elastin, making the skin thicker, and it will lift the area. So for this, we need to spread the product. So after doing the procedure, I am the first one on my nurse to massage the area. While I'm massaging, I explain the patient, we are going to do the same as home. There is no secret how to do it. So while I'm doing, I'm explaining. It can be with your fingertips, with the palm of your hands. You can use any device, and you can do with any kind of cream, oil. It's called the 5-5-5 rule, because 5 minutes per massage, 5 times a day, or 5 days. So it's just
I
5
see.
minutes per day, divided into 5 massages. So while I'm doing, I'm explaining, and also I give not a document, like a prescription. And I send a message on the next day asking if the patient has any doubts. And I ask, are you massaging? So it's the 5-5-5. And when they come for the second session, they know how to do. Sometimes they decide doing a new area, for example, inner thighs or abs, and they say, okay, you stay all day long massaging, because once you finish one area, you're going to.
You will
It's
go to the
okay,
other
nothing.
one.
Yeah, so for these, there is no problem to work out and to travel, but they cannot forget massaging. It's really important to spread the product, to stimulate the collagen as well.
Beautiful. Doctor, does it, the effect, does it last all the time? Or would it go gradually by time? Like,
Gradually.
would they need to do the same procedure again in the future or not?
So regarding hyaluronic acid body fillers, it lasts around 1 year, but it will reduce gradually. So they can top up anytime that they want, if they want to keep the same size. So I don't recommend that to wait until it returns to square one to do it again. And when we talk about collagen simulators, our patients are going to see the first effects after 1 month, so it takes some time, and the best effects after 3 months. And it lasts up to 2 years. Up to 2 years, we say that it lasts, but it's going to reduce gradually. So in 2 years, the patient will return to square one. So minimum, so what we recommend is minimum 2 sessions. So depending on the case, 2 or 3 sessions for butt lifting with collagen stimulators, for example. And I always explain, for your case, I recommend 4 vials, 2 per side, and you're going to do 2 sessions. And you can do a maintenance once a year, but then the patient doesn't need to do 2 sessions, for example, or 3 sessions. Only one, just to top up and to keep better over the years. So, but they text me, they come, doctor, I want to do it again. So around 1 year or before, because they really like the natural results, and it's a long-lasting effect.
Beautiful. Doctor, I saw on your page, I need to jump into another topic. You were talking about Monjaro and Ozanpec and the sculpturing that you do after. Can you please give me an idea what is Monjaro and Ozanpec? What do they do? And what do you usually do after?
Yes, so they are. There is a trend now. People are getting those medicines to lose weight, and they lose really fast. Sometimes in 1 month, or 5 kilos or more. So they are very happy with their new body shape. However, they look tired and sometimes unhealthy. So because they lose weight and they start melting their faces, and also happen to the skin, the body skin. But mainly when you lose really fat, when you lose weight fast, you'll see the effect first on your face. You look sadder, and your skin will be dehydrated, and you can see some folds, especially nasal labial folds and here the jaw. So what we recommend, especially because it's a medicine that you know when you are going to start using, not that you are sick, you are not expecting this, and then you need to start the medicine. You plan when you are going to use it. Is to maybe, if it's possible, to do one session of collagen stimulator before, because as I explained for the body, it's the same concepts for the face. It will take around 1 month to see the first effects. So you can prevent this. And for every 4 kilos that you will lose, 1 vial, that can be in one session, 1 vial of Sculptra is recommended. So the patient is not going to feel those undesired effects of their faces, because it's going to be tight and it's going to be a prevention. For patients that they don't do this kind of medicine, sometimes they come to my clinic and they ask, doctor, what can I do for my face? If I consider that they don't need any kind of fillers to replace any volume, to restore volume, or to add projection to some specific points, I ask them to do the pinch test. When we ask them to pinch the skin here, maximum that they can. So for some patients, actually if they have round faces, they didn't lose weight, it's difficult to pinch. But when the patient tries exercise, they don't have any fat on their faces, or they have slim face, or they lost weight with gastric sleeve, balloon, or Monjaro, Ozanpec, we can see the sadness. So I explain, you don't have any problem now. We don't know when it's going to start, but the aging process, you see this sadness, you start appearing here, start drooping. So if we do a collagen stimulator, it will tighten your skin to make your skin thicker, because sometimes it's so thin that when the patient smiles, we see the smile lines here. So with Monjaro and Ozenpic, it appears so fast. Almost they look older. They are happy with their shape. Everybody that stays there, what's happened? Are you sick? Are you sick? So instead of receiving compliments, oh, you lost weight, you look amazing. Everybody is, are you sick? Are you sick? So this was my recommendation. Yeah, yes, they want just compliment. So this restores their beauty, but in a natural way.
Beautiful. Doctor, as we age, like naturally our bodies are going to start shutting down, let's say, because the cells are changing and dying. Is there any way for us to fight off aging when it comes to our skin, like from your specialty? How can we fight off aging? What are your recommendations?
So, good habits. So, we are what we eat. So, taking care since childhood about what we are eating. Avoid some tannings, because the photo damage is really bad for the skin. So, we see hyperpigmentation, hypopigmentation, so both can be darker or lighter spot, and wrinkles, fine wrinkles. So using regularly sunscreen is important. And after 25 years old, 25 to 30 years old, we reduce our production of collagen by 1 to 2% per year. So that's why we talk lots about collagen stimulators to replace these and to fight against the aging process.
Collagen, does it help only on the skin, Or does this have any role, internally? Like, would the collagen supplementation help?
No, we have different types of collagen. Collagen is the main protein in our body. And if you are going to supplement with collagen, we have some of them that are specific for the joints and others specific for the skin, hair, and nails, for
Um,
example. That's made for the skin more than for the hair and nails. So they are different because the amount, also the quality of the collagen that we are going to supplement, but also the amount. So on average, with collagens, we need to take at least 5 grams per day. So if the patient tells me that's taking pills or tablets, I ask how many per day, and sometimes they say only 2. So I ask them to share with me the labels so I can share. But probably it's a low dose because every single tablet has maximum 500 milligrams. So to take
oh,
5 grams, the patient needs to take 10 tablets.
10 tablets.
And 10 tablets, so it's difficult. And the maximum that we recommend per day of collagen is 10 grams. So 20 tablets, it's really difficult. That's why
Mm.
good collagens, it's not only about being tablets or not, but the which kind of collagen
Quantity.
we are
You always
using.
start.
Yeah, it's but for example, that's why good collagens, they are powder or shots, because then we have huge amounts there. We are going to guarantee 5 to 10 grams. So they are powders that you use with a scoop to take the measurement, or they are shots that you can just shake and drink. And some of them, they combine with hyaluronic acid, vitamin C, because vitamin C also is important to build new collagen. So we have some gummies that they are good as well, because they have a lot of collagen there, but tablets, probably the patient's not taking the correct amount.
I see. So the quantity and the type of collagen plays a role
And if it's
whether we need it
for
for the.
the skin or for the joints.
Yeah, interesting actually. Because most of the people think that collagen is just collagen. No matter which
Yeah.
type, it's the help in everything.
Mm-hmm.
Yes. Doctor,
And
can
it's
you please give
difficult
me an
because
idea about content?
it's difficult because all the good collagens, they are made by fish. So if the patient is vegetarian, we cannot offer a good product to replace it.
It is available also in animals because I also once read that it's available in the ligaments and joints, bone of animals.
Yes,
So so people can also
yes.
maybe take it from bone marrow, like bone broth maybe.
The best ones, they are they come from the fish, and but that's why people think collagen is all the same. So they think if they are eating some kind of I don't know in English, but there are some foods that say, this is rich in collagen because it comes from the joints of this or that animal. But it should be perspective. The industry is going to do this. They are going to they are going to fragment the collagen in small particles that are going to be absorbed by our body. So it's not only have a good source of collagen, but the way that they are going to offer to your body to be easily absorbed. Otherwise, we are going to eat and we are going to lose everything without absorbing them. They need to be small fragments of collagen that are called peptides.
I see. I see. So like it's not only about taking collagen, work we take with collagen also plays a role.
Yeah.
Beautiful. Doctor, can you tell me about Botox? Is it safe or not? Because people usually say that it's a toxic substance. I'm not sure.
Yes.
Can you please give us an idea about Botox?
Yes, the dose that we use is not going to cause any serious disease. It's the toxins, but the amount that we use to treat wrinkles not going to cause any serious damage. For sure, depend on the area that it will be applied. For example, instead of lifting or raising the eyebrows, it can droop. So we have specific points that there is no recipe we use for every single patient the same way. So basically, it follows the expressions where it's applied. It lasts around 4 months, 4 to 6 months. And if you work out, it will last less because of the expressions that we do while we are suffering working out. So
Oh,
nowadays, I try to pretend that I'm not suffering. I'm there, lifting weights, pretend that everything is fine
but it's
to
easy
avoid
and it's normal.
doing an expression. And we have specific points to apply and some that we need to avoid, not to force muscles that are going to be important, for example, to keep the eyes open or not to give any asymmetry. And also there is a difference from female Botox to male Botox.
Oh,
Because, for example, for men, I always ask, how do you want your eyebrows? Because some women, they want to keep them flat. Almost all, they ask to raise and lift. And also it's important to ask them, for female patients, if they want to lift only the tail or if they want like this. So like number 8, Arabic. Or if they want just to lift the tail of the eyebrows. So for men, 90%, 100%, they ask just to keep the same position of their eyebrows, to keep the eyebrows flat. And something that's interesting is if the patient is bald, we need to add some extra points to avoid creating a new wrinkles where the
really?
hair could cover. So we need to know how to treat male patients, otherwise it's going to be completely weird. And nowadays, I think 30 to 40% of my patients, they are male patients. Last year was 50%. So this is interesting because they do take care of their appearance, especially here in Brazil. It's not common, so this is something culture that's different. But they want natural results. They just want to look fresh and younger, but keeping natural results. And we can apply Botox to treat the crow's feet in between eyebrows to reduce the angry expression. Here on the forehead, we have the Wi-Fi lines because they
The
are
Wi-Fi lines.
horizontal lines. We can apply here on the bunny lines. The more we get Botox, the more we have wrinkles here because we start compensating a new area. We can apply along the jawline to tighten this skin. Also on the neck. I need to do mine this week. It's my turn to do it. So it helps this kind of wrinkles here.
I see.
And we can do small doses. It's called baby talks or micro Botox to shrink the large pores on the cheek. And why should we need small doses? Because we don't want to hit any muscle that can cause an asymmetry while we are smiling. So
Oh,
depending on the area, we need to avoid. Sorry, we need to avoid some
yes.
points because we can have a side effect. And other areas that we can use Botox not to cause the expressions is on the scalp to treat some kinds of alopecia, to enhance the hair, new hair, and we can stop sweating for around 9 months if we apply, for example, on the underarms. It's an area that I do a lot here in the UAE. So it's called underarm Botox to stop or to reduce sweating. Also, it can be done, but it's really painful on the palm of the hand.
With dogs?
And yes, but it's painful, but patients can deal with this. We have some tips and some things that we do to reduce the pain. And also for patients that cleanse, so if they have bruxism, we can apply on the masseter muscle here on the side of the cheek, along the lateral part of the jawline. And if the patient has this muscle that's too strong, when we apply the Botox on this muscle, it's going to reduce the pain that they might have or cleanse during the night, and also to slim the face because it becomes so strong that the muscle turns the face to a square face. So it can slim the face once we reduce the volume of the muscle.
Doctor, how can you mentioned that we can use the Botox on the head to help in the hairlines or alopecia. What is alopecia?
Alopecia is the scientific name for hair loss. So when it's
Oh.
androgenic alopecia, we have so many treatments, and for some patients only the hair transplant. But it's something new, that combination with oral treatments plus PRP, exosomes, and Botox can reduce the alopecia and can increase the speed growth of the hair.
I see. So it can also be used in certain cases in hair loss. Wonderful.
Yes.
Doctor, on the final note, is there anything that you would like to share from your experience with the audience on how to, let's say, better take care of themselves? Let's say a way for them to prevent the problems in the future for your students, please.
I think we have to have a time. We have to find a way to be our priority, taking care of our mind and also our skin. So if you have a dermatologist that can listen to your concerns, and for example, if you are a person that is always traveling, your skincare routine is going to be different from another person that does outdoor activities, and for another one that stay all day long at home. So if you find a dermatologist to call the other dermatologist that listens to your concerns, you have a measure skincare routine to adapt. From time to time, it's important to change this skincare routine, not only not to get bored, but also during the winter is different from the summer. You can have some procedures along the year. I don't like procedures that you need to do so many sessions. And whenever I trace a plan for my patients, I explain you need to do this and that and that and that. You can do almost everything today, or those treatments you cannot combine on the same day. So I trace the plan, and then we start from the priority. So we having this in mind, you will plan over the year what to do. And also you do your part at home with your skincare routine to prevent the aging process. Having good habits, dieting, exercising, applying sunscreen, and why not, from time to time, doing some procedures.
Beautiful. Dr. Patricia, thank you so much for your time. Thank you so much for your experience and knowledge. I wish you nothing but the best. And thank you so much for being on the show. I wish you nothing but happiness.
It was my pleasure. Thank you so much. And if you have any doubts, it will be my pleasure to answer you later.
Doctor, how can we reach you? How can people reach you? Where can they contact you?
I think that the easiest is going to be sharing my Instagram account because it's easy.
Sure.
So, and there is my phone number and my website. So it's Derma in Dubai. So DERNAI in Dubai. Everything together.
Beautiful. I'm gonna share your page on our page as well because I hope that people get in touch.
Okay.
And you are wonderful. Thank you so much, doctor.
Perfect. Bye bye. Take care. Thank you so much.
Bye bye. Have a wonderful day.